I don't know about you, but for me, it is that time of the year when I really battle to get out of bed. I drag myself to work, and I'm not as razor sharp as I usually am during the course of the year. Long story short, I am burnt out. Good morning and a very warm welcome to Bonita's House Call here on SABC2. Ninage abakamthania bana bathesile bantu abakaphalo dumelang kaofela maAfrika Borwa a matle. I'm Dr. Victor Ramathesile dinanong lokisetsang ngaka ka tlung. Now we have had a long and hectic year, and with our successful hosting of the 2010 FIFA World Cup and many other activities, we have really ran our batteries flat. And as we wobble towards our well-deserved break, we still have to battle this burnout syndrome that we're talking about today. Now, to unravel this syndrome, we are joined into the studio by Dr. John Shabalala, who's a specialist psychiatrist, quite regular here on Bonita's House Call, as well as Dr. Craige Golding, who's a specialist physician. Gentlemen, thank you very much for joining Bonita's House Call. Now, you are going to teach me today about burnout syndrome, because when I was in medical school, they never taught me about this one. But first, let's watch this insert that's going to tell us a little bit more about burnout syndrome. Let's watch.
Burnout is a psychological term for the experience of long-term exhaustion and diminished interest. Many theories of burnout include negative outcomes related to burnout, including job function, increase in stress hormones, coronary heart disease, and mental health problems like depression. The array of symptoms associated with burnout is extensive. Physical symptoms are characterized by actual change in physiological body functions. Psychological symptoms show themselves in the attitude and feelings of the individual. Although not every individual exhibits the same symptoms, some symptoms of burnout syndrome may include low job performance or low job satisfaction, physical exhaustion and fatigue, rigidity to change and loss of flexibility, decreased communication and withdrawal with emotional exhaustion. During burnout, people feel unhappy and dissatisfied with their accomplishments on the job. The consequences of burnout are potentially extremely serious for workers on multiple levels, their clients, and the larger organizations in which they interact. And this is why, if you find yourself experiencing these symptoms, you must seek help. Burnout is no walk in the park, and just like depression, it may lead to undesirable outcomes if not attended to early on. There's no question that burnout syndrome leads to deterioration in the quality of care and service provided by the staff. It is an influencing factor in job turnover, absenteeism, and low morale. Coping successfully with stress is the key to avoiding burnout. The following individual or social strategies are the most common methods. Develop a realistic picture of yourself. Know what you're feeling and why. Recognize the symptoms of stress and burnout. Develop a structural and personal support system. Maintain an active personal and social life outside of work. Take time outs when you need them and maintain a regimen of proper nutrition and physical exercise. Having between one...
Well, it was a song that was made popular by Sipho Hot 6 Mabwisa a few years. Burnout, eh?
That was 1983.
Mm-hmm.
Yeah.
Yeah, big hit, big hit.
Very big hit.
Still a hit even today.
Oh, yeah, absolutely.
Now, it is burn, it is out. Now, burn is a verb, or in this burnt out, well, maybe it is a past participle, but of course, then out is a, preposition. Now, what is this thing? What are you burning?
Yeah, Victor, there's several ways of explaining this particular syndrome, which is people don't burn out as such, literally, but in a psychological sense, that people have lost the spark. You spoke about your batteries being having been flattened out because of the work and so on. People have a tendency to feel, you know, that lose that psychological spark, that edge, or you know, that loving of life, you know, due to several things. So they use burnout as a generic term to describe the general loss of interest in activities.
Are you saying to me, for us to perform maximally or optimally, both in a social and occupational way, we need physical attributes, or we need physical resources, in as much as we need psychological and mental resources? And when any of those have been depleted by whatever reason, then we say we have suffered from burnout?
Yes, absolutely, Victor. Those two things, those three features are in a delicate balance with each other, physical, psychological, as well as social. Now, if any of them sort of takes a wobble, a burnout can be the result.
Why does it become common this time of the year?
Victor, it's probably that people have been going on for a long time, or people haven't taken enough rest during the year. You spoke of the World Cup. The country worked very hard. And I'm sure there's lots of people out there who are exhausted, you know. And also there's a psychological feature of there is the holiday, you know. When you're reaching for the final step, you sort of say, when am I getting there? So there's a psychological slide to it. And I'm glad that you brought Craige with, because Craige is going to tell you that burnout is more than just a psychological thing. There's lots of physical things that can go wrong, that can result in burnout.
In my language, you say, we are not going to misquote you while you are here.
Yes.
So Dr. Craige Golding, you're a physician. Made a name for yourself in integrative medicine, where you look not only at the physical side, we look at all the aspects that make the total human being, and you also advance methods of managing all of those things, more in preventing problems than managing them once they've occurred. What is your understanding of burnout?
You see, Victor, there's a combination of things on the go. First of all, you have a certain physiological reserve, the ability to combat the stresses that we expose ourselves to. And there are so many of these stresses. They may be at the workplace, they may be at home, there may be environmental poisons that we expose ourselves to. There may be prolonged work, there may be inadequate rest. All these stresses, your body has an inherent ability to deal with. Now, certainly the most important endocrine gland in your body to deal with stress is your adrenal glands. They're the little glands that sit on top of your kidneys, and they help deal with stress. So you have this inherent ability, but when your physiological mechanisms to keep yourself sustained and energetic are overwhelmed, then you develop this condition called burnout.
Can I just hold you there, just to carry the viewer with us a little bit more? You say one of the main organs in the body that helps us in response to stress is the adrenal gland, which is that small gland that sits on top of each of it.
And that's controlled by your hypothalamus. So it's the whole endocrine.
Yes. What does it do exactly? How does it do this?
Well, the adrenal glands produce all your steroid hormones. So in response to stress and in response to life, really, you're going to produce hormones like cortisol, which are necessary to sustain life. Too much cortisol production is a fight or flight reaction. You know, the body produces too much of it. And then burnout is the eventual consequence of prolonged stress, where you actually don't produce enough cortisol and other hormones like DHEA, and your production of these steroid hormones actually declines, and then you have the burnout syndrome.
I see. So those hormones that are used to sustain life, to give you the vigor and the eagerness to wake up and face up challenges, decline a little bit.
Eventually gets depleted. Your ability to produce them gets depleted. Even if you're nutritionally compromised or hormonally compromised or aged, or you're exposed to too many toxins, for example, and you're unable to detoxify, all these factors combined result in you being unable to produce the steroid hormones that you need to sustain life and vitality and energy. So it's very important to look after your adrenals, as well as trying to minimize the stress that we expose ourselves to at the same time. And there are various ways that one can do that.
We're going to look into that. We're going to look into it. In a general sense, we may not have statistics, because I did say that at least when I got out of medical school, no examiner would stand in front of you and say, let's discuss, burnout syndrome. They would talk about many other syndromes at the time. Not even HIV was when you and I qualified. But talking about that, how many people out there would you say, by way of statistics, even if it's just a guesstimate?
You know, I would say that perhaps a third of the adults, of the working actively working adult population do at some stage experience burnout, and it presents in different ways. From my point of view as a psychiatrist, I see these people complaining of symptoms like depression, like anxiety, you know, and or agitation, and they come up to us. And we have to be doctors because, you know, part of what we do, we actually have to examine each patient physically because that's important. You may miss things.
Yeah.
You may miss other
And you cannot
bodily
assume that the
abnormalities.
doctor who referred the patient to you as a psychiatrist has done all of that physical examination, so you have to do it yourself.
Absolutely, Victor. It reminds me when I was a registrar at Bara, you know, somebody was sent to me as having been psychotic, only to find that they had pellagra. You know?
Oh, yes?
Pellagra, yeah.
So the doctor had not done certain basic physical tests to exclude, you know, any physical cause for whatever it is that seemed to be presenting as a mental condition.
Definitely. That's why we have to examine each patient. And I always say to my students, each patient must be examined. And if necessary, examine them twice or 3 times if you don't know what's wrong. We have to examine them, exclude any physical problems, and take a good history. Part of our biggest armamentarium, Victor, is a good history. You know, whenever the person says, I'm burnt out, we look into whatever, you know, ask about what medication they are on, their habits, and all of that, you know. And then sometimes they get impatient that, listen, I'm tired, and this guy goes on asking me lots and lots of questions.
I know.
But that's what we do.
We'll come to exactly how you wake up a patient who comes. Do people walk into your rooms and say, I've burnt out, or they present with other things, and then you then make a determination after having done some few investigations? And
Well, they can complain of burnout, and they often do, but they often present with a multitude of symptoms. It can just be fatigue, it can be fluctuating energy patterns. You know, they can say, and that is typical of burnout in comparison to conditions like an underactive thyroid, where you're tired all the time. With adrenal issues or the classic burnout syndrome or adrenal stress or adrenal fatigue, as it's also called, you have fluctuating energy patterns. So you wake up tired, you come right at about 10 in the morning, and you get a few hours work done, you're tired in the afternoon, you get a second wind in the evening, you're tired again. And then sometimes you wake up early morning hours if your cortisol is quite raised. So typically they complain of fluctuating energy patterns. They may complain of recurrent infections. They may complain of a chronic pain type syndrome.
Just hold it there, because they seem to be complaining about a myriad of things, so we need to work out a way of exactly how to pick up those people who are likely to be suffering from burnout, especially this time of the year. Mosotho wa kgale o re, lebelo le a fela, thota e sale. Empa o tjhetja harao, ha se o palea e le ho nka matla. We'll continue our discussion on burnout syndrome. Stay with us. Re boeletsa madume gompieno re leditse baitsanape gore ba tlo thusa go rarabolola letsapa le tsenang mo bathong ba bantsi go tlhelele ka morago go dira ka natla mo motseng bonage bogareng ba jara e re tswa mo go yone burnout syndrome kgotsa executive stress ka seesemane. Is it the same thing as executive stress?
Well, that's under the umbrella of burnout, sure. Absolutely. It's one of the
executive
causes.
stress is just one of the other, you know, components of burnout.
Absolutely. You know, there's so many conditions that can cause and lead to burnout. You certainly can't label it as one condition. It's multifactorial in cause, and it presents with a lot of symptoms, and there's many ways to deal with it. It's not a in the box, you know, typical one type of sickness like, for example, hypertension. It's a very complicated condition.
But not many people would go and consult a doctor simply because they feel exhausted. Would that be the case?
Not exactly.
Yeah, I mean, if you're tired, then you want to go and see a doctor. I mean, really, why don't you rest if you're tired? Yeah, especially for men.
For men, because we were discouraged from crying. Victor, here's a little maxim. If a patient comes and they complain of about 3 or 4 symptoms from totally unrelated systems, okay, headache, or a cough, or something else, I mean, 3 symptoms which are not linked, then you have to think of the kind of burnout issue. You know, you have to think of this is not a stress executive kind of stressors, especially higher functioning people. For some reason, this burnout will go and target people who are high functioning. Is it because they produce too much energy to get too much work done to their own detriment or what? We don't see burnout in Manofa, for example.
Yeah, but I'm sure our politicians, our big business people, you know, top corporate executives, these are the typical people who will present to you and say, look, I have this and the other. Or someone just walk and say, look, I've burned out. I just can't get out of bed.
Absolutely, and that's one of the distinguishing features between fatigue and burnout. Fatigue, you can restore your energy levels with rest. With burnout, it's a prolonged course that eventually leads to burnout. So it's not a case of two late nights and you know, you're fatigued and you have a few nights rest and then you're fine. That's not burnout. Burnout is almost a chronic condition that results as a consequence of prolonged stressors on the body.
How do you treat burnout?
Well, that is also, a very big topic. Obviously, you're going to deal with the issues that's causing it at the same time as you're going to be trying to deal with the adrenals and the person. You certainly want to try and clean up their diet. So nutritional health is very important. Sleep hygiene is very important. You want to, go to bed early without stimulants. Try and get a good night's rest. Try and deal with your stress. There's various ways of doing that.
Oh, don't rush. You said clean up your diet. What does that mean?
Well, you don't want all the junk food and the fast foods that we expose ourselves to.
Are they bad? Are they a contributing cause to burnout?
Oh, absolutely. It's harder for your body
Junk?
to...
But junk is so nice, guys. Come on.
It's nice, on the particular day, but the long-term effects on the body are very deleterious. It affects your hormone production. It affects your general health, your general energy, the way you detoxify, all of these factors. So it does lead to chronic fatigue.
And you said the next point is sleep without stimulants.
Yeah, well, I'm saying, when you go to bed, try and avoid stimulants in the evening. So avoid caffeine, avoid nicotine, avoid loud places, loud music, any stimulating activity that may interrupt your sleep. So you want a quiet room with dark light, a dark environment. So you want adequate sleep hygiene. It's very important. The restorative functions that happen in your body happen whilst you're sleeping. So sleep is a critical part of the management of burnout. So I spend a lot of time with my patients on their sleep hygiene. And there are a lot of nutrients that you can help people sleep with as well. Often with burnout, you have high cortisol, for example, and there's hormones like pregnenolone that counteract the effect of cortisol. There's vitamins.
So high levels of cortisol will lead to, among
inability
others,
to fall asleep, for example. Or if it's high in the morning, it may wake you up at 3 o'clock, for example. So there are hormones like pregnenolone that counteract that effect. There's nutrients like phosphatidylserine and vitamin C that can help lower the cortisol. There's sedating, herbals like valerian and passion flower that one can try. And hormones like melatonin can help sleep. So there are various ways to improve one's sleep hygiene.
Just hold it at that point. We've looked at your diet. We've looked at your sleep hygiene. What do you contribute to the two processes as a psychiatrist up to this point?
I'm glad you touched on serotonin, Victor. There's a new antidepressant that's coming, which is going to work totally differently, which is going to target the melatonin system, the sleep-wakefulness cycle, because recent evidence suggests that, a lot of people who are depressed and stressed are actually because their sleep cycle is disrupted. So this thing is not going to touch other things.
Not the other way around? Not that depression in itself will affect...
It becomes a spiral of doom, okay? Sleep disruption leads to depression, which in turn leads to sleep disruption.
Absolutely.
It's a spiral of doom. So this new antidepressant that's coming, and it's virtually free of side effects. It's going to work on the melatonin MT1, MT2 receptors, and it promises to be a revolutionary in terms of us treating depression.
When is it going to hit the market?
It's at the MCC now.
Is that so? In this country?
We can't wait.
So it's registered elsewhere?
In Europe, it's already been going on for 3 years.
No side effects?
We can't wait, Victor. We can't wait to give it a kick because...
But hang on, we know that depression, among others, is as a result of a lack of serotonin. Yeah. And which is why a lot of the antidepressants will try to increase the level of serotonin in individuals. And
not directly serotonin, but
among others. So, but you are saying you are moving away from that?
We are moving away from the serotonin theory because that shows the complexity of the brain and how little we know about the brain. Now we're targeting melatonin receptors MT1, MT2, which has proved to be quite as effective as anything else without the side effects. So science is moving.
Okay.
And you're improving the sleep, which is
We're
wonderful.
improving our sleep.
But maybe just to go back a little bit, Dr. Golding, if you allow me. We rushed into treatment, which is fine because, I mean, everybody out there who's watching this show, including myself, will want to know how do you sort out burnout. But if you have a patient that you suspect to be having burnout and they have all these symptoms that you're talking about, Dr. Chabalala speaks about a man who walks into your room and he complains about 4 different things in 4 different systems. You must begin to think about this, especially if it's this time of the year. How do you then investigate the patient to arrive at a diagnosis now that there are so many other conditions that can mimic burnout syndrome?
Absolutely.
How do you get to the diagnosis?
Well, Dr. Chabalala already alluded to it. I mean, you need to start with a thorough physical. You don't want to go and miss a cancer or an underactive thyroid or a hormone abnormality like menopause or andropause in a male. So you want to make sure that the person is physically otherwise well. And then you're going to know that what you're left with is an adrenal burnout type syndrome with or without a mood disorder. And there are various tests that one can check. Also at university, as you know, we're not taught about these kinds of things. We talked about clear-cut disease states. So, for example, when it comes to adrenal glands, we talked about the normal physiology of adrenal glands and Addison's disease. So complete burnout is Addison's. The burnout chronic fatigue syndrome is really the spectrum in between normal adrenals and Addison's. So what you need to do is testing to see where the functioning of your adrenal glands is.
Just describe Addison's quickly for the sake of the viewer.
Addison's is really adrenal gland failure, where you're not producing the steroid hormones that your adrenal glands are supposed to produce. And without those hormones, you cannot sustain life. And that's a very critical acute medical condition that you need to manage with steroid hormone replenishment.
This question is almost like saying how long is a piece of string, but let's ask it anyway. SMS that says, how long does it take to recover from burnout syndrome? This is Zandile asking from Northwest.
How many it can differ. Some people will respond fairly rapidly, and then you've got the 10%, 10 to 15% who are going to give you a headache. Whenever they walk into your room, your heart sinks. You know, you say, this is that patient where I've done everything. Fortunately, those are few. But for the rest, with proper history and management and proper follow-up, you can achieve a great deal of success. Importantly, as he has mentioned, the sleep hygiene, good nutrition, those and a lot of fluid intake. That's very important. They recover.
And also patience. You know, when people have a chronic fatigue type syndrome, inform them that they're not going to get better overnight.
Yeah.
This takes months to years, sometimes a year and a half before we sort out adrenals. Adrenals take a long time to sort out. We can get them feeling better within weeks to months, but it takes a long time to restore full adrenal gland function.
Is there a way of preventing burnout?
The person that will come up with that is going to be a billionaire because, you know, as we live, life is a stressor.
It takes a lot out of us.
Yeah, it takes a lot out of us. Life is a stressor. And as we live, we're going to meet with them. It differs from individual to individual how you handle that kind of stressor so you protect your adrenals from overfiring. You know, Victor, I just want to add one thing. Please, in females, we need to find out about the menstrual history, which is something that we don't ask. I mean, females have got menorrhagia there. And females rarely will tell you.
Menorrhagia, which is excessive menstruation.
Excessive menstruation. Some females don't want to talk about that. You know, they'll come and tell you, I'm always fatigued. And if you don't ask, you might just...
When in fact they're losing a lot of iron through excessive
They're using a lot of iron.
And that can present as something similar to burnout.
Absolutely, absolutely identical.
When we return, we'll continue our discussion on burnout syndrome. Oh, that makes many of us out there this time of the year. Keep listening and keep watching after the break. Welcome back. You're watching Bodyton's House Call here on SABC2, and today we are discussing burnout syndrome. So we are saying burnout, in essence, is a condition of the adrenal glands.
Adrenal exhaustion, really.
Adrenal exhaustion. Where the adrenal
in combination
glands
with other factors. You know, there may be neurotransmitter abnormalities as well associated, chronic pain associated, irritable bowel may be associated, because a lot of your chemicals that occur in your brain are occurring in your gut as well. So often bowel symptoms are present as well. So, but the adrenal glands are critical or a critical component.
And half the time, when you do an adrenal profile of those patients, you will certainly find something wrong with them.
You will, and there are various testings you can do. For example, you can do a morning at 8 o'clock in the morning, you can do a DHEA cortisol ratio. Now, these are two of the hormones that your adrenal glands produce. DHEA is a very important hormone for your health, for your immune system, for fat metabolism, to build bone, to counteract also the effects of cortisol and to build other steroid hormones. So you can do a morning DHEA cortisol ratio, and that should be 15:1. But what we often find in adrenal stress is a high cortisol and a low DHEA, and in burnout you find a low DHEA and cortisol. So that's one way of doing it. Another way is to do a salivary or salivary cortisol 4 times a day at 8 o'clock in the morning, 12 noon, 4 p.m. and 8 p.m. And you actually get a graph of your cortisol value. And this has been studied quite extensively around the world in the States and Europe. And you can get a graphic presentation of how your adrenal glands are functioning.
Interesting. Let's look at this SMS quickly. What's the difference between yappy flu and burnout? What is yappy flu?
Yappy flu
I've seen this
is
term.
a chronic fatigue syndrome. Yeah, he's alluded to it. Yappy flu is actually chronic fatigue syndrome.
It's not a virus.
Well, there's controversy out there. The jury is out there whether this is actually a viral infection, whether this is endocrine dysfunction, whether this is something related to fibromyalgia, pain and misery of unknown origin. So the jury is out there.
Tell me about those patients. Tell me about those patients. Pain and misery of unknown origin. You investigate, the R doctor, you'll investigate, you'll take them to physio, take them to acupuncture, and those are very frustrating patients. Hey.
Yeah, those could be the yappy flu. Those people suffer. They actually suffer, and their suffering is more organic, but you can't find anything.
Boy.
We do investigate them to attempt to find causes. There are viruses like Coxsackie, Epstein-Barr, cytomegalo, and as you've mentioned, endocrinological abnormalities. So we can investigate them. And critical in these chronic fatigue syndrome people is to have a look at their adrenal glands and have a look at their neurotransmitters, protect them there as well.
I must confess, I've never done as a matter of checking, I did not learn profile. I must have missed a lot of these patients in practice.
This is the problem. A lot of it goes undiagnosed, and it's diagnosed as depression only. And it often isn't just depression. There's an adrenal gland component that needs to be addressed. You can't just give all chronic fatigue sufferers an antidepressant and expect them to get well.
So if they are lacking in this hormone, do you give them a replacement?
Yes, you can. If they're adrenally fatigued, in other words, their DHEA production, for example, is very low, you can replenish DHEA. If their cortisol production is very low as well, and you've confirmed this on urine testing or saliva testing or blood testing, you can actually replenish cortisone as well. And you can give it at certain times of the day, and that can energize them significantly and change their lives dramatically. But you don't always need to resort to hormones. Hormones are really somewhere between adrenal fatigue and Addison's that you're going to, or even Addison's as well, that you're going to start thinking about that.
There's a lot in between.
There's a lot you can do.
What exactly?
Well, you want to make the adrenal glands function a bit better. So first of all, you would use, as we've already mentioned, good nutrition to help your adrenal glands function better, because you need these nutrients in your diet to make the hormones.
What kind of nutrients would these be that would make your adrenal glands function?
For example, you need vitamin B5, so you need good quality B vitamins to make cortisol. Without B5, you can't make cortisol. So eating your veggies is very important for adrenal gland health.
Vegetables again. Hey, you guys with your vegetables.
Absolutely.
Hey,
and if
if
your cortisol is low, you can fuel your body with the nutrients and hormones that it requires to make the hormones. For example, if you want to make cortisol, you need B5 and progesterone. So you would check the progesterone level and replenish if needed to make the cortisol. And then you could use something called adaptogens, which are of plant origin, but they fuel or help your adrenals really to recover and make the cortisol again. Other nutrients are important too, like vitamin C, other hormones like pregnenolone. Pregnenolone is the mother of all steroid hormones. So if you give pregnenolone, your body will use that, or your adrenal glands will use that
to
make
that in food
hormones
as well?
No, you'll need to give that hormone, and that
would have to be a supplement.
Yeah, or a prescription hormone. when you're using them.
Which kind of person gets burnout syndrome? What profile of it?
The highly functioning person, the executive person. Sometimes it's been called executive stress. The executive person, the highly functional, highly driven person can get that. People who are, always on the go will get that. I just want to say that maybe there's something that we haven't alluded to in terms of treatment. We encourage them to exercise. Fatigued though they feel, exercise has got the beneficial effect because it's going to drive his cortisol, you know?
Seriously.
Yeah, so
paradox.
like
Not too much in the beginning. Give them, be patient with them. Yeah.
yes, it's an interesting paradox in that.
So exercise is part of your regime? In management
Absolutely,
business?
absolutely. Big part. But if you over-exercise and your cortisol is up, for example, if you're adrenally stressed, you'll push your cortisol up even more. So that can be a problem, and you can precipitate panic. The other problem is if your cortisol is very, very low and you're very fatigued, you won't be able to exercise. So you've got to be patient with the person and see where they are in terms of their adrenal picture. But I agree, exercise is critical. Just to me, you know, nutrition, sleep, hormonal health, exercise, they're all critical elements in the management of burnout.
Does it interfere with sexual function?
Yeah, Victor, if you're burnt out, I mean, part of what happens is that you lose the libido, because I mean, sexual activity is a sign of good health, and quite often in our clinics, you know, you ask a person, "How's your sex life?" and they look at you like, "Listen, you're being curious or out of it," and I explain to them, "Listen, I'm not curious about your sex life, but about your health, because sexual activity, good sexual activity, is a sign of good health." Yeah. So in burnout, people are not interested. I mean, they're too tired.
Interesting. Now, just to go back a little bit again, when you talk about the adrenal gland and what it produces, what are some of the critical functions that the hormones that are produced by the adrenal gland do? Because once we understand that, then we understand exactly what the people with burnout syndrome lack. What do they do? What have you said? They are good to sustain life. But can you expand on that a little bit?
Sure. They're essential for metabolism. So, for example, fats and proteins are used to make energy. You need your adrenal gland hormones to facilitate that process. You need your hormones like DHEA for adequate immune system function. That's why often with adrenal issues or with chronic burnout issues, you get recurrent infections or allergies even because of the high cortisol or the depressed DHEA, the low DHEA, because of the adrenal stress or burnout will result in allergies. So it's very important for metabolism or control of metabolism. It's very important for your immune system. These hormones are very important for growth, for muscle growth, for bone growth, for the repair of your body. They're very important for mood. You know, hormones like pregnenolone and progesterone, these steroid hormones are all made from precursors in your adrenal glands. So without these hormones, you become depressed, you lose your sex hormones, you lose your libido. So, you know, the adrenals have a multitude of functions. You cannot function without your adrenal glands. Addison's, as we mentioned earlier, where your adrenal glands are failing or have failed is very close to death. You know, once you have full-blown Addison's, it's just impossible to
Now, what's the difference between
life.
cortisone and cortisol?
Well, it's just there's various forms of steroid hormones that are produced in your adrenal glands. So, for example, when you prescribe a steroid, you would prescribe. There's so many that you could prescribe: meticortin, prednisolone, prednisone, pregnenolone, DHA. It's a whole group of steroid hormones that you can prescribe. Cortisol is really the umbrella term for the hormone that's produced in your adrenal gland. Cortisone is really the pharmaceutical that we prescribe when we're trying to replenish the steroid hormone, or when we use it for specific indication when there's an illness in the body.
Now, we spoke about stress. Stress, life is a stress, and because of the stress, the adrenal glands take a beating, and then in the end, they end up not functioning properly, and they end up with How do you describe stress?
Well, stress is a state in which there is a psychological tension as well as physical tension, and obviously that plays a role in disturbances of the whole metabolism. For example, one case in point is that due to hormonal disturbance, some females may not menstruate when they're under stress, or they may menstruate, you know, when they're not supposed to because of stress. So stress is both physical and mental, you know, because of perceived social or occupational or even internal changes. For example, if you have an illness, any kind of illness produces stress in you. Obviously, it pushes some hormones up, including cortisol. So you experience a feeling of stress, which is psychological as well as physical, you know. So you get psychological symptoms, restlessness, insomnia, poor concentration, and all of those things that we always describe. And insomnia is one of them as well. So that we will describe as
So
stress.
lack of sleep or poor sleeping patterns.
Yeah, on the physical side, you'll have things like elevated blood pressure, sometimes hypertension, and many other physical sequelae of stress.
When you come back from the break, we'll hear what Dr. Craige Golding has to take, or what his take is on what stress is in terms of the discussion of today, which is burnout syndrome. Please remember you can continue the discussion on our website, as we have a resident doctor who can attend to all your queries. We'll continue our discussion on burnout syndrome after the break. Welcome back. One is Ratswela pele ka hloho sa letsatsi mona ho Bonitas House Call ho SABC2. Lenaneo le utlwisetsang ngaka ka tlung. And today we are discussing burnout syndrome. Now, he's described what stress is from his point of view as a psychiatrist and as a generalist, giving us a sense of what it is all about and how this ties in with burnout syndrome. You have a slightly different take on what stress is?
Yes, I mean, you know, there's various ways of describing it. I mean, stress per se, if someone says they're feeling stressed or they're experiencing stress in their life, it's really a subjective symptom they're experiencing. So that's one way of describing it. It's the way they feel. It's a feeling that they have. They're feeling stressed, they're feeling wired, or they're feeling wired and tired and wound up and just, you know, stressed. That's the subjective symptom that I'm referring to. And then there's the objective assessment of someone when I would say they either have acute stress or they have chronic stress with or without burnout. So I would say acute stress, for example, is a leopard jumps on here on the table in front of us. We're going to get an acute fright, an acute stressful response. Our adrenal glands are going to pump out cortisol and adrenaline, and we're going to run like hell. That's an acute stress that our body reacts appropriately to. A chronic stress or chronic stressors that we're exposed to eventually result in overburden of our adrenal glands and the inability to cope with it. And this is what burnout is. It's a chronic stress that we're no longer able to deal with in an inappropriate fashion.
What professions, in your view, in your experience, would have a higher number of people with the burnout syndrome than others?
Yeah, I think, you know, we've already spoken about business executives, people who are really burning the candle at both ends, so people who are really working hard. The stock market, people who there have been known to have a lot of burnout. Air traffic controllers are high on the list, a lot of stress there. Doctors who are working long hours, people who have interrupted sleep cycles, you know, people who are working nights and not getting adequate sleep hygiene that we referred to before, they're classically prone to it. People who have very high environmental toxicity, for example, heavy metal burden or cigarette smoking, too much alcohol, plus too much work, plus too little rest. You know, it's really a lifestyle-induced condition. It's not just about the bodily defense mechanisms that are exhausted. It's really about our lifestyle and not adequately dealing with stress and all that we expose our bodies to.
Would frequent holidays interspersed between the year try to maybe alleviate the effects of this?
Yes, you know, Victor, when we were growing up, I mean, in the township, we see these whiteys taking caravans and going. We said, what the hell, these guys are wasting money. But that was very important when you later learn that, you know, this is taking frequent breaks in between. It's actually investing in yourself, you know. It is such an important thing to do that, you know. Even, I mean, we don't do it that often, you know, but it is very important because you go there, you relax, and, you know, you recharge. But now we have a new enemy, the cell phone. That gadget.
Yes.
When you go on holiday,
people can't go rest.
People can't go rest because somebody will call you, a patient calls you, or somebody in your business say, listen up, hey, I can't get this and that. And that has interfered with the people's ability to relax and take a break. I don't know how we're going to manage this little gadget, but it's very important for everyone. And I'm not saying go to the coast. You know, you can go to the farm, you know. And then just sit and chill. You know, if you've got a couple of cows, go and head the cows, for example, and do something different that will help you chill. I think it's important.
I've seen this in sports, as a sports physician, where you find you have a player who suddenly really loses form completely, you know,
Yeah,
and,
it's really
and they lose their
overtraining syndrome.
sharpness, they lose their ability, and they lose the hunger for the game. And it gets very difficult because if he's a striker, for instance, and a player whose performance is out there, because if you're a striker, you must score goals in football. And if you don't score goals, you're not a good striker. Whereas if you're a midfielder, you know, you can hide behind some of these things. And I'm just not certain how many of these people have we missed who could have had something like this?
Well, absolutely. I mean, it's a similar kind of condition that they ultimately have. It's just a different cause. So overtraining, which is what you're referring to, is similarly going to cause a burnout because your nutritional requirements are perhaps more than you're fueling your body with if you're overtraining. So maybe you're protein deficient or chromium deficient or mineral deficient or vitamin deficient because you're overtraining and not supplying the necessary nutrients for that amount of training. And once again, if you're overtraining, you may be hormonally not balanced. So, and you know, overtraining is a stressor to your body, and it's going to elevate your cortisol. It's going to be a strain on your adrenals. So ultimately, the cause is just different, but the pathogenesis or the way that we get to being burnt out is similar. You know, it's multifactorial, resulting in a burnout type syndrome.
Let's get this straight now. Do you want your cortisol to be high or to be low?
I want it to be normal.
You want it to be normal?
Yeah.
If it's high, there's a problem.
It's an appropriate response to have it as an acute reaction for your cortisol to go up when you get a fright or you need to react quickly.
But if it's sustained at a high level?
That's going to lead to what we call adrenal stress or anxiety and panic, and that's not good for you. That will cause you to gain weight, feel stressed. It'll affect your mood. It'll affect your sleep. It'll make you feel generally tired and unable to sleep. So it's not good for you. And cortisol suppresses your other hormones. It suppresses your immune system. It will lead to allergies. So it won't make you feel great at all if you have prolonged stress.
Yeah. Neither do you want it to be low.
Absolutely. Prolonged stress is high cortisol. When it's low, that's when you have the burnout or fatigue. And that's even worse.
Yeah.
That's when your adrenals are now burnt out.
Okay. Let us now say, as we're winding down this discussion, and I think it has opened a lot of eyes in terms of that burnout syndrome is a syndrome. So it is a combination of various conditions that all relate to something that can be described to a specific cause. That's what the word syndrome means.
Absolutely.
But of course, it has many, many, many facets. Now, if you are going to give advice to people, a lot of us are tired now. Some of them maybe it is just fatigue. It's got nothing to do with burnout. Some it could be burnout. But in a general sense, towards the end of the year, if you are working with people who seem to be exhibiting these symptoms, or you are maybe supervising people who seem to, what is your general advice on how to deal with this?
It's very difficult to give one generic advice, but if you had a team of people, I mean, it's important to know the strengths and weaknesses of each one. And if you think any of them may be suffering from burnout, I think it would be prudent to talk with each one. How do you feel? What is going on? Is there anything I can do to help? I think that's very important to have a close working relationship with them and know them on a more personal level. Because it's not, it's not all work stress. You must remember, when you work with people, they are first individuals before they are your teammate or workers. Yes. So try to
exist within a particular world.
Yes, try to see them as a whole.
Would burnout have something to do with maybe toxins and other waste products building up in your body?
Big time. What you want really to sustain good adrenal health and good energy levels is balance. And it comes down to, we've already spoken about the nutrition and the hormones and managing your stress and so on. But environmental toxicity is a big factor these days that is not investigated well enough either in a lot of our fatigue patients, because we are exposed more and more and more to these toxins. And the detoxification process in your body takes up a lot of energy to actually accomplish the process, and that can also result in fatigue. The foods that we eat, the water that we drink, the air that we breathe, the electromagnetic radiation. There's so many toxins out there, and that does deplete our body of the energy.
Wouldn't that recommend at the beginning of the year, at the tail end of the year, that people must go for all these fancy, well-advertised and well-marketed detoxification processes, where people go to a farm and they eat all the greenies and everything, and they are given massages and stuff like that?
That's a fantastic idea.
It does,
there's various ways to detox. Obviously, you have your liver, the major organ of detox. You can detox via your skin by having infrared saunas, for example, or increased perspiration through exercise. That's detox. You detox through your bowels by having good gut hygiene and going to the loo regularly. Also, again, it comes down to eating well and having good hygiene and good bowel habits. So detox is a big part of it. And obviously, there again, there's a balance between how toxified you are and how well your detoxification processes are working. But you can enhance detoxification.
Would it work? Would it?
Yeah, Victor, as it talks about detox, I'm thinking of my old lady back in the time of my childhood when every Saturday you had to get that.
Castor oil,
you had to get the enema or the castor oil, or else no money to go to the movies. You know? And I hated it with a passion.
Does it work?
Well, Victor, if you look at it now, it's actually a way of cleansing up.
We'll talk about that. It was good. Ebathena sebenza kanobomi kulo nyaka siyayazi ke into okubana nidiniwe ke ngoku nemizimba yenu ichafile nenhliziyo zenu azisekho kulezi zinto okumele ukuba niyazenza emsebenzini yenu nine-burnout syndrome ngamafuphi. Now we'll end up our discussion on burnout syndrome when we return. You stay with us. The hour is gone. It's gone. You're watching Burnout House Call here on SABC2 and welcome back. Sama khoya ka magoro ga se la tlhana. Empa pele re tja dipologwane tsa rena re shutela bangwe ka rena pere tšhelete mantse ya go laela go tswa go ba eng ba rena ba le go. Fine. I think this is a very wide subject. A lot of people are suffering from this. It should not be confused with ordinary fatigue that a lot of people would have this time of the year. It is a recognizable condition that has got many factors to it, but it is a recognizable condition where the adrenal glands are not functioning optimally. What would be your key words of advice in dealing with burnout syndrome?
My last word would be that if you feel that you are more fatigued than usual, if a good night's sleep doesn't really help you, it's time to look for help. If other areas of your life, like functioning at work or at home, are affected, it's time to look for help. You know, it never is cowardly to look for help. I'm talking especially for men. You know, men don't like to look for help, but men, if you feel you're tired, if you feel you can't go on anymore, and you can't do the things you used to, it's time to look for help. Any help will do. Because, you know, we're functioning as a team. If I find something that he can do, I'll send you to him. If he finds something that I can do, he'll send you to me.
But at the end, both of you are looking after the same patient and many other professionals that you might bring into the fray. Yes. Your words of advice, Dr. Golding?
I would say, you know, your adrenal glands look after you. Look after your adrenal glands and try and prevent this burnout. It's not good for yourself. It's not good for productivity. It's not good for society, all these people with burnout. So look after your adrenal glands and try and prevent it. Prevention is the medicine of the millennium, and I believe you can prevent burnout if you have a balanced life and you pay attention to all these aspects that we've spoken to.
Eat well.
Spoken about.
Exercise. Sleep
well.
And have
manage your stress.
Detox.
Work when you need to work. Relax. Have balance.
And have balance on all factors of your life. Dr. Jan Chabalala, Dr. Craige Golding, once again, yet again, thank you very much for having joined Burnout House Call. You have indeed educated us on burnout syndrome. And starting with the next year, we'll make sure that we enter that year with more gusto and, of course, more energy. So to say, ethala ibuela mosetlelo. Banabis, a ke re phomoleng he jwale sepheo le morero e le go netefatsa gore re gutlela mesebetsing ya rona selemo se tlang mesebetsi ya rona ka go fapakana re le mafolofolo ebile re le mahlahla. Please remember to visit our website on www.housecall-ec.co.za or you can call Johannesburg 285-6180 to get more information on this show or to obtain DVD copies of any of our shows. Remember also to continue the discussion on our website as we have a resident doctor who can attend to all your queries. We'll be back next Saturday with another interactive show here on SABC2, so don't miss it at 9 in the morning. Hlanganyela nathi futhi ngokuzayo. Ari kopaneng hape ibekeng e tlang. Thato Haile. Thanks for joining us today. And for me, Dr. Victor Ramorisi Ramatisile. Look after yourself.